Thank you so much for attending. Um, I said in the chat, we are recording this for your convenience, and we'll send it out to all attendees subsequent to this. I think it'll be the next couple of days. Again, thanks so much for being with us. I want to introduce my colleagues who are also supporting us today. Firstly, we have Vanessa Zapata. She is our staff attorney, one of them, and she is an expert on all the things that we're going to be talking about today, eligibility, and she's a great, great resource. So thank you so much, Vanessa, for all the work you've done towards this webinar. Thanks for being here. And also want to shout out to Thomas Hill, who is our grant and data coordinator. He is behind the scenes, making sure that everything goes smoothly technology-wise. So appreciate you doing that for us, Thomas. Thank you. He's also going to be keeping an eye on the chat or the Q&A. So we will address all of your questions after our presentation here, which we can go ahead and start. So Thomas, if you want to show us those slides, we're going to first talk about the agenda for today and looking at what we're going to be talking about. Thanks so much, Thomas. Okay, so as you know, this webinar is called How to Spot Issues and Access Help. Well, how to spot issues with what? That would be spotting issues with folks who are vulnerable to having their TennCare or becoming disenrolled from TennCare due to redetermination, otherwise known as renewals. So we're going to discuss who will be affected by TennCare's year-long redetermination phase. We're going to talk about how children and families who depend on TennCare will be affected over the year-long redetermination phase. And most importantly today, how communities, individuals, and organizations like you can help TennCare recipients and help each other. Okay, next slide, Thomas. And thank you all for putting your organizations and your names in the chat. Appreciate that. Okay, so let's first cover, and many of you already know this, but it probably bears reviewing. Why is TennCare requiring renewals all of a sudden? What is this change? Well, that is because for the past 3 years, under the public health emergency, all TennCare recipients have been under continuous enrollment. So they were just enrolled no matter what, and they didn't have to renew or be redetermined. So now that the public health emergency is winding down, everyone who's enrolled has to go back through that redetermination, returning to annual renewals. And I just want to stop on the word redetermination. I don't really use this outside of healthcare spheres, just to the greater public. I'll say renewals because that makes way more sense. It's just such a simpler concept. But redetermination is really, I think, a good term for us to use because it does mean that everyone is going to be looked at to see if to determine if they're still eligible for TennCare. So that's a really important piece of what we're working with because some people will find that they're no longer eligible. We want to make sure that they find that out with plenty of notice. Okay, I think we can go to the next slide. Now, many of you work with children, and that's your primary concern. That's understandable, it should be. So we need to talk about how renewals will affect children. Really, it's the same way that being uninsured or underinsured affects children any other time of year. But it could affect their school attendance, most importantly, if they can't get to a doctor or they are or suddenly find that they have an emergency and they try to make a doctor's appointment or try to get treatment and their parents suddenly realize they're not covered. That's obviously going to affect the child's school performance, and it's going to delay them getting treated because if they've been disenrolled, then they'll have to go through, there'll be some delay in some space of time where they're not covered. Okay, we can go to the next slide. Let's talk about how parents and other caregivers will be affected. And I'll just read from my slide here. Parents and grandparents already under immense pressure trying to provide for the children under their care. So receiving an overwhelming renewal packet from TennCare on top of requirements for other assistance programs that they might be taking advantage of is definitely not a welcome event for many caregivers. So caregivers who find out that they have been disenrolled at the moment of an emergency, like I spoke about before, or medical pharmacy need, they're going to need extra support, help, and urgency from all of us. Now, ideally, we'll head these off at the pass and we'll be really proactive, but we can just expect that there are going to be a large number of people who we just can't reach, and they won't know until a moment of urgency that they're no longer covered. There is help for them, so we're going to talk about that. Next slide, please. Okay, so you see here that I've used an icon of an iceberg. I just want to, kind of emphasize here that we don't need to, any of us, put undue pressure on ourselves to know everything at this moment in time. I think even TennCare probably doesn't know everything at this moment in time. There are going to be things that we can't foresee. But we can look at some issues right now that we do know that some folks will face during this redetermination phase. So that's what we're going to talk about next. Next slide. Some of you on this call know about this Medicaid category pretty well, but for those of you who don't, there's a category of Medicaid called the medically needy spend down. It's kind of a hard category to fall into, but this is something that I think is helpful for everyone to be aware of. So if a family has high medical expenses or medical debt, and these are expenses that they have paid out of pocket, not covered by insurance, it's possible that they could, and that's anyone in the family. If a person, or even more than one person, has high medical expenses or debt, they may qualify to be in the medically needy spend down category. So these are low-income persons who are also either a child up to age 21 or pregnant. So the children or a pregnant person in a household may be eligible for TennCare if someone in the household has incurred high medical expenses. So like I said, it's a hard category with several limitations, but some children and pregnant individuals will be eligible under the medically needy spend down. So if you all have any specific questions about that, write those down and we'll talk about it in the Q&A. But wanted to make sure that everyone is kind of aware that there is a category for this type of situation. Okay, next slide. All right, now, what if a person does not submit his or her packet by the renewal deadline? Next, Thomas. Well, a person can still complete a TennCare renewal packet for up to 90 days after they've been terminated, disenrolled. So that's only if their renewal application was never, ever submitted, like if they never received it. Or if TennCare asked them for some documentation to verify something, and the person just never sent that stuff in. Well, there's still hope for them. They have 90 days after that, they could still get the process rolling. Now, if someone does not receive their renewal packet, they can take advantage of the 90-day allowance. That's if the renewal materials are submitted and approved within 90 days of termination. There'll be no lapse in coverage. So this is especially important for folks who have incurred medical debt, because there's a chance that they can get reimbursed for that. Okay, next, thank you, Thomas. And this is really why TennCare Connect is really our great friend right now. TennCare Connect is TennCare's online portal, and it is going to be so instrumental in keeping folks enrolled and keeping people aware of when their renewal date is going to be, or what they need to be, what they're being notified about through TennCare. Because many of you on this call work with people in transition, or experiencing homelessness, or are just moving around for whatever reason, or have moved around in the last 3 years. Well, it's very important for these people to learn to rely on TennCare Connect, because that is a remedy for them to not have to depend so much on physical mail at a permanent address, because many of them just can't count on that. So we have a little video that we're going to show that it's actually how to apply for TennCare on TennCare Connect. But at the beginning, it shows you how to set up a TennCare Connect account. And I would really stress, and if you need any help with this, we're here for you. Just reach out. But setting up your clients with TennCare Connect accounts is probably of the utmost importance right now, especially when you're working with people experiencing homelessness. Okay, next, Thomas. I think the next one is our video. No, not yet. Okay, next one is our video. So I just want to, before we go to the video, discuss 40-20-90. I think this is a term that's kind of coined by our COO, Rob, but it's a good group of numbers to keep in mind when you're dealing with the deadlines. Okay, and these are things that everyone will have questions about. Okay, so a person will have 40 days to submit a renewal packet, and that's from the date that's on the renewal packet when they receive it. Now, if you have TennCare Connect, you'll be able to see that on that portal. Now, if TennCare comes back to that person and says, we need verification of your income, your address, your household size, whatever, then the person has 20 days to get TennCare that documentation. They can do that through TennCare Connect, and I would really advise that they do that through TennCare Connect, because you can see on there what you've submitted, and TennCare can see, and so everyone's in agreement that it was submitted and received. That's kind of saved us in situations in the past, especially when we're dealing with denials. Another note on the 20 number is that TennCare will give 20 days notice ahead of terminating someone's TennCare. But again, if they're relying on a permanent address, TennCare Connect will be the real much better option if they can't rely on a permanent address. And then finally, they have 90 days to submit a renewal packet after termination. So if you didn't receive your packet, or you failed to respond to the request for more information, you can still, after being terminated, have 90 days, like we discussed in the previous slide. That person still has 90 days to submit a renewal. So if someone gets kicked off, it's not a great situation, but we don't have to panic, because there are these safeguards in place. Okay, I think we're ready for the next slide. Want to talk a little bit about the caretaker relative category, because this is a category that even TennCare has expressed some confusion about at times. They certainly know what they're doing, but this is kind of a complicated category where you have to ask for all the right things. And it's helpful if you who are navigators through this process, or like our client advocates, if they know what to ask and what information to glean. So a caretaker relative category, what that means is that if you're a relative by blood or marriage, you're taking care of a number of children, the caretaker relative and the child or children may be eligible through this category. If you're a blood relative or non-relative overseeing day-to-day care of the child or children, the adult may not be eligible, but the children may be. So I just want to emphasize here, if you are a grandparent who's taking care, your grandchildren are living with you and you are seeing to their day-to-day care, it's quite possible, maybe you're on a different insurance, you're already insured, but those children, you have the right to apply for TennCare for them. You do not need their parents' permission or anything. You can quite likely, they are eligible, and you can enroll them in TennCare. So I just want to note here that TennCare has been known to make the mistake of counting income of the caretaker, and that makes the child financially ineligible for coverage. But the caretaker's income should not be counted if that child is not adopted or if the caretaker is not applying for her or himself. Okay, so if there's any confusion about this, y'all, you're going to get these slides, but also, jot that down for the Q&A and or go ahead and put it in the Q&A and we'll address it. We'll clear it up for you. Okay, next slide. All right, right after this is where we're going to talk about TennCare Connect. What can we do to keep children and caregivers from losing their ability to receive medical attention? Okay, so next slide, Thomas. We're going to entertain you all with a little informative video here. Enjoy.
One moment while I refresh this.
As Thomas is working on that, I will just address one of the questions that we did get in the chat. And if you do have questions, please go ahead and put it in the Q&A. But the question was, if someone has SLMB and has custody of a child, she was decided Medicaid because she was denied Medicaid because her income was over 1,100. Is that correct? So it really depends on the household calculation. So I think if I can remember correctly, the income limit would be dependent on whether or not the child is claimed on her taxes. And then depending on the household size and anyone else that might be claimed on her taxes, then the different income limit would be applied for this caretaker. So if you need any help understanding kind of what household size definition might be for that particular household, please feel free to give us a call or a referral because we can assist in understanding more directly for that person. But basically the short answer is it depends on the household size under the definition of TennCare and the countable income for that household.
Thanks, Vanessa. Okay, we are ready with the video here.
Here's how you can apply for healthcare through TennCare Connect. Start by searching TennCare Connect in your web browser. Then scroll until you find tenncareconnect.tn.gov. Now that you're on the home page, sign into your existing account, or if this is your first time, create a new account. You should now see what is known as your coverage dashboard. Using the quick access menu, you can check the status of previous TennCare applications, submit any requested documents, or apply for coverage. Before you start, take some time to read up on programs that may be available to you. In this first section, TennCare will ask some basic questions about the head of household, such as your name, address, and if you or an assisting person are completing this application. An assisting person is someone who acts in your best interest to help you navigate the application process, such as a parent or power of attorney. Note that for some of these examples, legal documentation may be required. Next, TennCare wants to know about the people in your household. Here's a list of people you do and do not need to include, as well as some information that may be asked of you. Now that you've identified people in your household, step 3 is to list everyone's relation to each other. Step 4 will ask you to list the tax filing status of everyone in your household. Be sure to indicate if you filed jointly or claim anyone in your household as a dependent. Next, list out any pre-tax or Schedule I deductions that reduce your gross income. Here are some examples of things to consider. In step 5, TennCare will ask you about your gross employment income. You can report if you've recently lost your job, how much you get paid, and how frequently you get paid. If you are self-employed, you can utilize the designated self-employment question to report this information. You will also need to report any other countable income. Excluded income such as supplemental security does not need to be reported. Finally, complete a series of yes or no questions about healthcare you are currently receiving, and you're done. Once you've submitted an application, you can check your status online or download the TennCare Connect app. Here, you can view your coverage dashboard, upload necessary documents, and read decision notices from TennCare. For additional information about eligibility or healthcare programs, visit tn.gov/TennCare or tnjustice.org.
And shout out to Asia Porter, who's one of our client advocates who did the amazing voiceover work on that video. Thank you. Now, I want to emphasize here that that video covers actually enrolling, just a first-time enrollment. We don't have the interface yet. We don't know what it's going to look like for renewals, but it will be pretty similar to that, we're thinking. And also, I think that video is just good for getting people comfortable with using TennCare Connect and realizing that it's a great tool. So now that video I can send to anyone. It'll be on these slides, but I can send that video to anyone if you want it. I've been sending it around to a lot of partners just because they're sharing it with their staffs so that everyone knows. Okay, so now let's talk about how to access help. Here are the things that we would advise. When it comes to figuring out how we're going to reach people who are on TennCare and how to educate them on what is happening, I think it's always helpful to remain open-minded and really creative. We want to meet people where they are and keep our minds really open to any ideas. Partner, partner, partner. That's why you're here. I don't really have to emphasize that to this group, but I'm always really, really excited to partner with anyone and figure out ways that we can help our clients all together. Reach out for help. You can reach out to the Tennessee Justice Center or others for help. Communicate. Now, I want to say one thing here about communicate. It's probably it's definitely going to be necessary for all of us to continue to communicate with each other. So what the Tennessee Justice Center is planning to do is host regular advocacy calls so that we can all support each other. I envision it as being, kind of a call where we come together and say, well, here's what I'm seeing with renewals, and here's what I experienced, and reaching out to each other for help, and then supporting each other and sharing information and experiences so that we can all serve the community as best we can, and we can support each other. Don't rule out any idea, and stay involved. And one way that you can stay involved is keep in touch with TJC. Some of you attended a previous webinar that we had, and we're keeping a list of all those attendees. And I will be reaching out to you. I've got it all ready to go, but we'll be reaching out to all of you with news about what we're offering and the help that we can give you. And I hope that you do the same, because we want to support your organizations as well. Okay, next slide. All right, here's some examples. One would be a renewal or enrollment clinic. And I want to just insert here, many of you know, TJC is not the only one, not the only organization who can do renewal and enrollment clinics. So we can partner with some of our other friends who do this same work. Next. Parent-teacher conferences. I think, some of our best partners are in the schools. And last week, our casework supervisor and I went to 2 different schools at 2 different locations entirely, parts of the state. And we just set up so that we could answer questions that parents might have when they came in for parent-teacher conferences. And a lot of the parents asked me, not really for themselves, but they have a relative or friends on TennCare, and they were really appreciative to have a face-to-face conversation with somebody about it. So, you know, if you want to reach out to your local school system and get us involved, or not, you just want to go on your own, please, you know, do that, because they'll be very, very cooperative. Okay, next. Providers and hospitals send letters to TennCare patients. I think different hospitals and different providers are approaching this in different ways, probably in ways that really kind of suit their clientele the best, and they know who they serve. But if there's anything that we can do to help you with this, come up with materials, or you know, brainstorm about how to reach those patients. I'll give you one example that was so fruitful. I went to a Centerstone Mother to Mother event on last Thursday, and almost every single person there was on TennCare. And I would say I probably talked to about 25 or so people. Only 2 of them had ever even heard that renewals were going to happen. So we got to find ways to reach those people. Pharmacies would be a great place to reach people, because they are probably in pharmacy. In some cases, people are in pharmacies more regularly than they are a doctor's office, because they might need medications on a monthly basis, or even more frequently. So I will admit this has been a little bit of a toughie, or a little bit of a challenge, because it would require getting the cooperation of some pretty big name brand pharmacies like CVS and Walgreens and Walmart and Kroger and others. However, we've gotten some really, really good response from people in the community with family-run pharmacies or just local pharmacies. So I actually encountered some people who in Cheatham County on Saturday who were just, yeah, give me the information, I'll take it to the pharmacy myself. I have a good relationship with the pharmacy. They're wonderful. So that might be the best way to reach people in some cases, through pharmacies. Okay, next. Hospital revenue cycle vendors, if we have any on this call, just know that we're your allies. We're here to help you. And I would encourage you to reach out to me if you haven't already. I'm in touch with some of you, but if you haven't already, reach out to me and we'll figure out a way that we can ally with you and help your clientele and help you. Community resource fairs, there's always a high level of interest there. So if you have any of those, get somebody who can talk about TennCare to, and even multiples, get somebody who can talk about TennCare to those community resource fairs. And also contact your legislators or representatives just to let them be aware, make them aware of what you're seeing in your own neighborhood or your own community. Because what's going on in your area might be a little bit different than what's going on in another county or another area, but your representatives need to know that. And Thomas, if you'll hit enter one more time, I think I put a link here of how to get in touch with your legislators. This is where you can put your zip code in and you can see who your representatives are. Okay, I think we're ready for the next slide. All right, so we're going to do some Q&A, but before that, we're going to give you 5 minutes to scan this code and fill out this short survey for us. And then when you're finished with that survey, you can read some other things I have here on the page. If you are watching this webinar and listening to this webinar on a recording, you can still scan the QR code. We still love to hear from you. So thanks for doing that. I'm going to give you all, I'm going to set a timer for like 4 minutes, and then I'll let you know when you've got a minute left.
Hi, everyone. Sorry, I had a technical difficulty in sending the link. I was accidentally sending it to just one person, but it's linked in the chat now, and we're just taking a little pause for y'all to go ahead and fill that survey out. It's really helpful for us to kind of get that feedback so we can make sure we're addressing all of the issues that y'all might have and improving our presentations on this issue.
Okay, I think it's been about 4 minutes, but certainly if you need more time, please take it. I'm just going to review the rest of the things on this slide. You probably saw this in your survey, though. So we are going to be reaching out to attendees if you indicate that you want to volunteer or you want to attend the regular advocacy meetings or calls that I was referring to earlier. How to refer clients, patients, families to Tennessee Justice Center and become a partner. Or if you want to host an enrollment or renewal event. You don't have to be in Nashville to host an event. We are located here, but we serve the entire state. And we do that very proudly. We really love our partners who come from the eastern part of the state, the western part of the state, and everywhere else around Davidson County. So we do have virtual opportunities where we could do a virtual event, and that is where someone can meet with a client advocate online, so they can still have a one-to-one conversation with that person, and we'll walk them through the renewal packet. And then also if you want to attend future trainings. Okay. Do we have one more slide, Thomas, or is that the end? We might not have one for Q&A, but.
Yeah, I think we have one more slide.
Okay.
So I'll let you finish up, Shayna, and then I'll go ahead and review some of the questions we had for those who may have missed it in our Q&A or in our chat box.
Okay, thank you, Vanessa. Yeah, this last slide will just show how to get in contact with me in case you are not already in contact with me. And also, would you all please share this with anyone else that you know of? We're going to be sharing this recording with you too, and you can share it with any other partner that you want or anyone else that you feel like may not have been able to make it today, but is interested in this topic. We want to make sure that we're supporting them as well. So that'll come up shortly, but we can go ahead and get to the Q&A because we got some really great questions here.
Okay, so I'm just going to go through some of the questions that we've received. I tried to answer them as they were coming in, but I just want to make sure folks are able to know what the questions that have come in. So first, one of the most asked questions is, will these slides be available after the training? Yes, we will be sending this out. So any of the folks that are registered, the email that you use to register for this event, you're going to get that. You're going to get the slides, you're going to get the recording, and we'll also include materials that may be helpful for your network, such as a flyer that allows people to either know our number or scan our QR code to fill out our case inquiry form in case they have questions around public benefits like TennCare. But we also work with SNAP and WIC and other programs as well. And then another question we had in, will you address seniors on TennCare? So our organization does work around seniors accessing public benefits like TennCare and SNAP. and long-term services and supports that are paid through TennCare programs such as Choices. We actually have an independence team where we focus on seniors or older adults and adults with disabilities. For the redetermination, one of our main focus tends to be on families and children, parent caretakers, pregnant women, because they have the way that they are categorically eligible is has a lot of kind of reference to their income, and they have the annual redetermination. Some adults with disabilities and seniors won't be subject to redetermination depending on how they receive TennCare. So we're really trying to focus on folks that may lose out just because they didn't get a notice or something like that. So that's kind of why we tend to focus a lot of our presentation on children and parent or caretakers. Another question was how to refer to our organization. Shayna has explained that, but I'll also kind of post in our chat, and this will also be sent by email. And so you can just give a call or fill out our case inquiry form. At the moment, I will say we are closed for intake for certain cases, just because we're trying to gear up our staff for the redetermination that is going to start kind of happening in the next couple months. Shayna, did you have some?
Thank you, Vanessa. Yeah, I just wanted to say one word about our case inquiry form. What it is, and I do have a QR code for it too, so I can email that to you or get that to you if you want. But the link that Vanessa is going to send you takes you right to the same place. But basically what it does is it's a way for someone to contact us and say, I want Tennessee Justice Center to reach out to me. Here's my phone number, and here's a good time of day to reach me. And also here are some bits of information that I want to talk about, whether it's TennCare or other benefits. So it's a pretty simple form. There's also a place, I think it's number 12, that's just an empty box for you to share whatever other information you want. So if the person needs a certain language, that would be a good place to put that in. I need Arabic or I need Spanish, because then we can have that already ready to go when we call them at the time that they prefer. And also, it would be fine if you filled this out on someone else's behalf. So if someone comes to you and wants you to help them fill it out, you just put their information in. It's just contact information. It's nothing terribly invasive. One reason why I bring that up is because social workers and counselors will sometimes tell me they want to do it on behalf of an unaccompanied minor or some child experiencing homelessness. They just want to make sure that it gets done correctly and that it gets done. And sometimes they want to be involved in when we call them back. They want to be there for that meeting just to make sure that it's getting done. So thank you.
Thanks, Shayna. And for our partial close of intake, that will be lifted after April 1st. So please feel free to refer all folks who might be having issues accessing programs like TennCare or SNAP and may need more guidance with the redetermination, the renewal packets. And then I also wanted to go back to the question that we had earlier about the caretaker. In that situation, I did assume, and that's already the first mistake, because the categories of eligibility and household size are really dependent on like the household or the person. So you don't want to make assumptions. You want to understand all the facts, make sure that they fit in line with the rules. But of course, if you guys don't want to kind of get into the weeds, that's what we're here for. But in that situation, I assumed that the caretaker was the grandparent. And so there's different rules in terms of the caretaker relative category of TennCare coverage, depending on how you're related to the person in terms of like the household size, and it can get kind of into the weeds. So I'm not going to go all the way into that, but basically just want to make sure y'all know that it's pretty fact specific in terms of who's your makeup, your household makeup when you send in an application. We also got a question that I'm not familiar with, but there a new rule that with TennCare, the PCP needs to be within 30 miles or 30 minutes from the client or patient. So if anyone actually has the answer to that, please feel free to enter that into the chat. And I will refer that question to some of the folks that work more with providers in our organization. And hopefully we can just add that into our wrap-up email after this event. But also if that individual wants to email Shayna or me directly, please feel free, and we can hopefully clarify that. Are there any other questions? I don't see anything coming in, so I just want to make sure I'll have the space to ask questions if you have.
And y'all may think of things later on that you wished you had thought of right in this moment. If that happens to me all the time, so I don't know if I'm the only one that happens to or not. But again, just reach out to me, and I may not know the answer, but I'll make sure that someone who does know the answer addresses it, and we'll get you the answer that you need. I want to thank you all again for showing your commitment to this issue and making sure that we can prevent as many disenrollments from happening as possible. I'm going to emphasize again here, stress again, I'm open to any ideas. Partnering with other organizations like Family and Children's Services and Tennessee Healthcare Campaign who do this work, I think is a really, really good thing to do, especially considering the number of people who are going to need our help. So reach out to me, let's plan things. And I'm open to ideas. So thank you all so much. Thank you to Vanessa. Thank you to Thomas. Thank you to Asia for your video. And I hope you all have a great rest of your week and a restorative weekend. Thank you so much for being here.